Okay, this is our board behind us. This is one table we're using for our setup. This is another. And then this is our last one. And we're having to move the camera ourselves because no one else is here to video for us. This is my patient, Kaylee Bernard. She's 20-year-old female. And I'll wash my hands before entering my patient's room. Okay. So hi, Miss Bernard. How are you today?
I'm good. How are you?
I'm good. My name is Mason, and I'm a student nurse with UAM. Is it okay if I provide care for you today?
Yes, ma'am.
Okay. Do you need a drape to cover yourself before we begin the exam?
I don't.
Do you need to use the restroom before we begin?
No, ma'am.
Okay, can you tell me the day
It is Friday.
and the date?
It is June 19th of 2020.
Okay, who's our president?
Donald Trump.
And where are we?
We're at my house.
Okay. So what brings you in today?
I hurt my wrist.
Where is this pain?
The whole wrist right here.
Okay. How long has this pain lasted?
For about 2 weeks.
Can you describe the pain? Is it sharp, shooting, stabbing?
It's a pretty sharp pain.
Okay, does this impair your usual daily activities?
Yes, ma'am. It makes it hard to go to work.
Okay. How do you treat your pain?
I ice it about twice a day for 20 minutes, and that helps a little bit.
Okay, so what makes your pain worse?
Using it at all.
And what makes it feel better?
Not using it.
Can you rate your pain on a scale of 1 to 10?
Probably a 7.
Okay, now we're going to talk about your past medical history. Have you had any major adult or childhood illnesses?
No, ma'am.
Are you up to date on your immunizations?
Yes.
When was the date of your last tetanus shot?
Probably about 3 years ago.
Okay, do you have any other major illnesses or injuries I should know about?
No, ma'am.
Have you ever been hospitalized?
No.
Any surgeries?
No.
Have you ever had a transfusion?
No.
Do you get routine screenings such as pap smears and mammograms?
No, ma'am.
Do you have any allergies?
No.
Are you currently on any medication?
No.
And what would you say your mental status is?
I would say I'm very happy.
Okay. Now we're going to talk about your immediate family's health history, which includes your parents, siblings, or grandparents. So how old is your mother?
My mom is 39.
And what's her health status?
She's very healthy.
Okay, how old is your father?
He's also 39.
What's his health status?
Healthy.
Do you have any siblings?
I have one brother and he's 16.
Okay, what's his health status?
He's healthy also.
Do you have any grandparents on your father's side?
Yes, on my father's side, both of my grandparents are in their mid-60s and both healthy.
Okay, and on your mother's side, do you have any grandparents?
Yes, they are in the early 70s and they are both healthy and alive.
Okay, have any of them had a history of heart disease, lung disease, liver disease, thyroid disease, kidney disease, cancer, stroke, epilepsy, diabetes, arthritis, tuberculosis, sexually transmitted infections,
No, ma'am.
blood disorders? Okay, now we're going to talk about your personal and social history. So where were you born?
I was born in Pine Bluff, Arkansas.
Okay, what is your current living situation like? Can you tell me who you live with?
I currently live with my parents and my brother.
Okay, what's your home environment like? Do you have carpets or pets?
I don't have any carpets or pets.
Okay, what's your marital status?
I'm not married.
Okay, what's your education, your highest level?
I'm currently enrolled in college.
What's your occupation?
I don't have a job.
Do you have any stressors?
School.
Do you exercise any?
No.
What's your nutrition and diet like? Can you tell me what you had for breakfast this morning?
I try to eat a well-balanced diet. I try to incorporate vegetables and protein in every meal. For breakfast, I had an omelet and bacon.
Okay, do you perform any self-care exams?
No.
Do you drink alcohol, caffeine, use tobacco products, smoke, or use recreational drugs?
No, ma'am.
Okay, do you travel? Have you traveled anywhere in the past 6 months out of the country?
No, ma'am.
Okay, do you have any religious preferences?
I'm a Christian.
Okay, do you have any cultural requirements I should know about?
No, ma'am.
And do you have access to care such as transportation and health insurance?
Yes.
Okay, now we're going to talk about your sexual history. So how many partners have you had?
One.
All right, are you on birth control?
No.
Do you use any protection?
No.
Okay. All right. So now I'm going to ask you a few more questions. Do you have any pain anywhere other than your wrist? Excessive sweating, night sweats?
No,
Okay.
ma'am.
Do you have rashes, itching, or
No.
excessive sweating? Do you have any changes related to hair loss, such as distribution, color, texture?
No, ma'am.
Okay. Do you have any changes in your nails, such as brittleness, thickening, separation from nail bed,
No, ma'am.
itchiness? Okay. And have you ever had a head injury, loss of consciousness, headaches?
No.
Okay. Do you have changes in your eyes, such as double vision, blurring, light sensitivity?
No,
Do you
ma'am.
wear contacts or glasses?
No.
Okay. Do you have any hearing loss, earaches, ringing, vertigo, dizziness?
No.
Do you wear assistive devices such as hearing aids?
I do not.
Do you have any nasal discharge, changes in smell, obstruction or sinus pain?
No.
Okay. Do you have any dental problems, difficulty chewing, swallowing,
No.
changes in taste?
No.
Okay. Do you have any enlarged or tender lymph nodes?
No.
All right. Do you have shortness of breath, chest pain?
No.
Okay. When was your last chest x-ray?
I don't believe I've ever had one.
Okay. Do you have any breast tenderness, lumps, or milk production?
No.
And do you have any swelling in extremities, clammy skin?
No.
Okay. And how many pillows do you sleep with?
Just one.
All right. Okay. Do you tend to bruise or bleed easily?
No, I do not.
Do you have any blood clots?
No, ma'am.
Okay. Do you have any blood disorders such as anemia?
No.
Do you have any nausea, vomiting, indigestion, constipation, diarrhea?
No.
Do you have changes in bowel movement?
No, I haven't.
Do you have enlarged or tender thyroid, heat or cold intolerance, changes in weight?
No, ma'am.
Changes in distribution of hair or increased height or glove size?
No, ma'am.
Okay. Do you experience any frequency when urinating, burning when urinating, dark or discolored urine, blood in urine?
No, ma'am.
And how old were you when your period began?
I was 15.
Can you tell me about it? So, how long does your period usually last? How many tampons do you use?
Okay. My last period was probably about 2 weeks ago. I get it every 3.5 weeks, and it'll probably last 3 days, and each day I use probably 2 tampons.
Okay, when was your last cycle?
About 2 weeks ago.
All right. Other than your wrist, do you have any joint pain, stiffness, limitation in movement?
No, ma'am.
Okay. Do you experience any tremors, paralysis, memory loss?
No.
And do you have sleep disturbances, problems focusing or concentrating, and suicidal thoughts?
No, ma'am.
Okay, now we're going to start the physical assessment. Okay, so hair is brown, evenly distributed with no infestations. Scalp is pink, free of lumps, lesions, or masses. Okay, now I'm going to touch your face.
Okay.
Can you open your jaw? Close it. Move your jaw to the left, to the right. Poke your chin out and pull it back in. Okay. No popping your crepitus upon palpation of temporomandibular joint. I'm going to touch your face again. Can you clench your teeth? Okay. Cranial nerve 5, trigeminal intact per clenched teeth. Now I'm going to tap on your face just a little bit and you let me know if you feel any tenderness or pain.
No, ma'am.
No pain or tenderness upon percussion of sinus regions. Now we're going to go through some facial expressions. Can you raise your eyebrows? Wrinkle your forehead? Purse your lips? Blow out your cheeks? Smile. Now show your teeth. Cranial nerve 7 intact per facial expressions. I'm going to touch your face again on your eyebrows. Eyebrows are intact, symmetrical bilaterally. Eyelashes are full and symmetrical. Now I'm going to touch your eyelids. Can you close your eyes for me? Okay. No lumps, lesions, or masses of the eyelids. I'm going to touch again, so close your eyes for me. No drainage of the lacrimal duct. Cranial nerve 2, 3. Ocular motor intact for no ptosis. Sclera is white. Iris is blue. I'm gonna touch your face again. Conjunctiva is pink. Okay, then we get some tools. Now we're gonna go through some more motions together. I'm gonna shine this light in your eyes, and you let me know, or just look straight ahead for me. Okay, eyes are symmetrical bilaterally per corneal light reflex test. I'm gonna shine the light in your eyes again, and just look straight ahead. Okay, pupils are round, reactive to light. Okay, now I'm gonna hold this pen right in front of you, and you just follow the tip of my pen and keep your head straight. Okay, cranial nerve 3, oculomotor 4, trochlear, and 6 abducens intact per cardinal field test. Now I'm gonna hold this light in front of you again. You're gonna look at me and then focus on the pen when I say so. Okay, focus on the pen. Okay. Cranial nerve 3, oculomotor 4, trochlear, and 6 abducens intact per corneal accommodation, Okay. I'm going to get you to hold this chart in front of you. I'm going to cover your right eye and you read the smallest line possible.
Okay. 9, 3, 7, 8, 2, 6.
Okay. Left eye is 20, 30. We're going to do the same thing with your other eye.
9, 3, 7, 8, 2, 6.
Okay. Right eye is 20, 40. And then I'm going to look at your pupils, so you just look straight ahead. Pupils are 3 millimeter per Rosenbaum chart, and cranial nerve 2 optic intact per Rosenbaum chart. Okay, move hair for you. Ears are symmetrical bilaterally. I'm going to touch your ears. No lumps, lesions, or masses upon palpation of the auricle. Now, I'm going to stand behind you and click my pen, and you let me know how many clicks you hear after each ear.
2. 2.
Okay, cranial nerve 8, acoustic intact per whisper test. Okay, can you tilt your head back for me? Septum is midline with no deviation. Nostrils are symmetrical bilaterally. I'm going to touch your nose. Breathe in and out. And again. Patency of each nostril is symmetric bilaterally. Okay. Lips are free of lumps, lesions, and masses. And can you open your mouth for me? Hard palate, gums, buccal mucosa, floor of mouth are pink, free of lesions. Soft palate is white, free of lesions. There are 29 teeth present, none missing, and no cavities. Okay, can you close your mouth for just a second? Okay, open again. Uvula is midline, no deviation. Tonsils are present with no drainage. Oropharynx, pharynx, and pillars are present with no drainage as well. Okay, can you stick your tongue out for me? Tongue is pink, free of lumps, lesions, or masses, symmetric. And move your tongue to the right, to the left, up, and down. Okay, I'm going to put my hand on your cheek, and you touch your tongue to your cheek for me. Okay. Strength and full range of motion of the tongue, cranial nerve 12, hypoglossal intact per, strength and full range of motion. Okay, can you say ah? Okay. Cranial nerve 10, vagus intact per ah test. And can you swallow for me? Okay. Cranial nerve 9, glossopharyngeal intact per swallow test. Okay. Neck is erect in midline. No jugular vein distension noted. Okay, let me put this down. I'm going to touch your neck just a second. No deviation of thyromegaly or trachea, no thyromegaly. And push against my hand for me. Now this side, and back. Okay. Now we're going to go through some movements together. So we're going to put our head down first. Flexion, back up, extension, hyperextension, lateral bend, and rotation. Okay, cranial nerve 11, spinal accessory, intact per strength and full range of motion. Put my hands on you and do a shrug for me. Okay, shoulder shrug intact, cranial nerve 11, shoulder shrug intact. Okay, I'm going to touch right here. Okay, carotid pulse 2 plus bilaterally. I'm going to feel your throat for something. Okay, trachea is symmetric with no deviations. Now feel for your lymph nodes. Okay, occipital, postauricular, preauricular, tonsillar, submaxillary, submental, superficial cervical chain, anterior cervical chain. I'm going to head this way. Deep cervical chain, and supraclavicular cervical chain. No palpable lymph nodes. Okay, now we're going to look at your arms. Skin is intact, free of lumps, lesions, or masses. There's no tenderness or popping of the fingers. Capillary refill is immediate, 1 to 2 seconds, and nails are well groomed. To this, radial pulse, brachial, radial, radial and brachial pulse 2 plus bilaterally. Okay, epitrochlear lymph nodes, axillary lymph nodes, epitrochlear lymph nodes, and axillary lymph nodes. Okay. And now I'm going to inspect your back. You move the camera. Okay. Can you lean forward and cross your arms for me? Skin is intact, smooth. Shoulders are symmetric and scapula are symmetrical bilaterally. Respirations are even, deep, and unlabored. I'm going to put my hands here and you take a big deep breath for me. Thoracic expansion is symmetrical bilaterally. Now you're just going to repeat after me. 99,
99,
99,
99,
99.
99.
Okay, now I'm going to tap right here and you just let me know if you feel any tenderness and tactile firmness is present. Symmetrical bilaterally. Okay?
No, ma'am. No.
Okay. No tenderness or pain upon percussion of kidneys. Okay. I'm going to listen to your breath sounds, and every time you feel my stethoscope move, take a deep breath for me, okay?
Okay.
Okay. There are no adventitious breath sounds upon auscultation. Okay. Can you turn this way just a little bit? And raise your arms above your head, and we're going to listen to breath sounds here. Same thing. Take a deep breath for me every time you feel my stethoscope move. No adventitious breath sounds. Now we're going to do this side. Same thing when you feel my stethoscope move, take a deep breath. No adventitious breath sounds. Okay. Okay. Skin is intact, free of lumps, lesions, or masses. No popping or crepitus upon palpation of chest wall. Respirations are even, deep, and unlabored. Okay, we're going to do the same thing. So, let me actually, when you take a deep breath for me. Okay, thorax expansion is present, symmetrical bilaterally. Okay, repeat after me. 99,
99,
99,
99,
99.
99.
Okay, tactile firmness is present, symmetrical bilaterally. Now we're going to do the same thing. When you feel my stethoscope move, take a deep breath for me.
Okay.
Okay, no adventitious breath sounds upon auscultation. Now we're going to listen to your heart, so if you could lean forward for me. Okay. Aortic. Pulmonic. Second pulmonic. Tricuspid. Now mitral. Alright. S1 and S2 heard upon auscultation of the heart. Okay. Now can I get you to lean back for me? Your feet facing this way. Skin is intact, free of lumps, lesions, or masses. Pulsation, symmetry, and movement are present symmetrical bilaterally. Contour is flat. And listen to your bowel sounds. Bowel sounds are active times 4. Now I'm going to listen for any bruits. Okay. No bruits upon auscultation. Just going to palpate your stomach now. No lumps, lesions, or masses upon palpation. And can you raise your head and shoulders off? Thank you. Okay. No obvious herniations. And can you straighten your legs out for me? Skin is intact, warm, free of lumps, lesions, or masses. No edema present. Nails are well groomed. And capillary refill is immediate. Hair is evenly distributed. Okay, now can I get you to pull your toes to you? Now point your toes to me. Okay, we're going to do the same thing. Pull your toes to you. Now, push them to me. Good. Okay, strength and full range of motion of the feet bilaterally. Okay, can you sit up for me? Okay, let me get this. We're going to go through some superficial touch sensations. Okay, so this is what it feels like. Okay, so can you close your eyes for me? Tell me now every time you feel it.
Now, 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 now.
Okay, you can open your eyes, and cranial nerve 5 trigeminal intact per superficial touch. We're going to do the same thing, but with sharp and dull. Okay, so this is sharp, This is dull.
Okay.
This is sharp. This is dull.
Okay.
So tell me now, every time you are sharp or dull, whenever you feel. So close your eyes for me.
Dull. Sharp. Sharp. Dull. Dull.
All right. Trigeminal, cranial nerve 5, trigeminal intact for sharp and dull sensations. Okay, can I get you to pat your lap like this quickly? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, rapid rhythmic alternating movements intact per lap tap. Can you hold your arms out like this? Close your eyes and you're going to touch one finger to your nose.
Okay.
Close your eyes. There you go. And again. Okay, you can stop. Accuracy of movements are intact per finger to nose test. Okay, can I get you to come stand over here for me? Remove the camera so you can see. Can you hold your arms by your side and close your eyes? Okay, open them. Now stand on one foot, now the other. Negative Romberg test. Okay, balance is steady and coordinated. Now can I get you to take 10 steps towards me, walking normally. Okay, now turn around and walk heel to toe. All right, okay, smooth and symmetrical bilaterally. Now can you come stand right here for me and bend over. Spine is symmetric in midline. And that's flexion. Can you stand up? Extension. Now you can face me. We're going to go through some movements. Hyperextension, lateral bend, and rotation. Okay. Full strength and range of motion intact. And thank you for being my patient today.